Hi, this is Janine. I want to thank you for joining me today for this webinar. And I want to apologize for the difficulty that we were having on Tuesday for the Medicare fraud one. So I'm going to talk for a few minutes about Medicare fraud before we get into the Medicare updates. It'll be really short. But before I do that, I wanted to just tell you a little bit about myself. Um, my name is Janine Davis. I have been doing this for about 15 years or so, probably longer than that, actually, now that I think about it. The company that I am with is called Lifestyle Safety, and we have a 5-star rating on Google and A+ with the Better Business. We are also appointed with most major carriers, so we are a one-stop shop and would love to continue to help you with your Medicare decisions. But first, let's talk about a little bit about Medicare fraud. I really wanted to talk about this because I was at my dad's house and his phone was ringing every 5 minutes with somebody calling him about Medicare and trying to get him to switch and to change. And this year in Michigan is going to be a lot of different things going on, and it's going to be a lot of changes, which means that people are going to focus on Michigan. And I don't want you to get caught and get changed to something that you didn't know you were changed to or anything like that. So I wanted to give you a few tips that could help you in this process. First, your Medicare card. I want you to treat it like your Social Security card. Don't give out your number to anyone. They don't need to necessarily get your number in order to give you a quote. The only reason why somebody would need your number is if they need to check your Medicaid status. Other than that, they do not need your Medicare number in order to give you a quote. Because if they have that Medicare number, that's how they're switching people to things that they didn't know that they were being switched to. So if you give out your Medicare number to someone, just know that only give out that number if you are planning on switching your plan unless you have Medicaid. If you have Medicaid, you may need the number so that they can check your Medicaid eligibility. Secondly, don't answer calls from people that you don't know. If you every phone, whether it's Android or iPhone, they have this cell phone, they have this ability where you can block calls to numbers that you do not know. I would suggest that you do that. It's so funny. I put that on my dad's iPhone, and he's like, well, now I have to pick it up because I don't think it's working. That's how much his phone was ringing, and he was so used to it that when it got quiet, he didn't really know what to do. But that's something that you should consider. But with that, you also want to make sure that all the numbers that you do want to go through, your family, your friends, your doctors, me, your Medicare agent, or any other agent that you may have, you want to make sure that you have their numbers in your phone so that they won't go straight to voicemail. These calls will go straight to voicemail, and so you can check the voicemail later. But if it's somebody that you need to talk to, you just want to make sure that they're in your phone, and then your phone will still ring. Thirdly, there's something called the Do Not Call list. It's www.donotcall.gov. You can put your number on that, and that should cease all marketing of people calling you on the phone. Um, it helps, but it's not 100% because they still call even though you're on the Do Not Call list, but it should help some. And then finally, you want to check your explanation of benefits. Whenever you go to the doctor or to the hospital and they send in a claim, the insurance company will send you out an explanation of benefits, whether that's from original Medicare or from an insurer. You'll get that in the mail, and just kind of look at it to make sure that everything on there is something that you have done. If there's something on there that you see that you have not done, then you want to report that as fraud. And you can call 1-800-Medicare. You can call your insurer. There's different ways you can report that. But those are just 4 quick tips for you, because I don't want you to get into a situation where your plan is changed, you didn't realize it was changed, and then you go into next year and the plan does not work the way that you need it to work. And of course, that's going to be a problem. So now let's move on to what we're going to be talking about today. We're going to be talking about the 2026 Medicare updates. So there's a lot going on, but what we're talking about today is not plan specific. What we're going to be talking about today is just going to be just general updates that are happening in 2026. So first, we're going to begin with the costs. Usually for Part A, which is hospitalization, you don't have a cost for that because you've paid into the system. If you paid into the system, then the cost for Part A is always zero. If you have not paid into the system, the cost is going to go from $518 to $563. Now, mind you, all of these numbers for 2026 are what they are projecting them to be. They have not come out with the 100% yet, but this is the projection of what 2026 is going to be. If you're a person that has only has original Medicare, or you have original Medicare with a supplement and you have to pay that Part A deductible, it's going to go from 1676 in 2025 to 1716 in 2026. Again, that's an approximation. Your Part B premium, this is something that most people do have to pay. Right now, you're paying $185, but in 2026, you're going to be paying $206.50. So it's projected to go over $200 for next year. So keep that in mind as you're thinking about your cost for 2026, that you're going to be paying over $20 more a month in premium for your Part B. And a lot of times that comes directly out of your Social Security check if you're receiving Social Security. The Part B deductible is going to go from $257 to $288. The Part D, which is your drugs, are going to go from $590 to $615. So there are going to be some plans, or on most plans, where you have to pay that deductible. It could be initially for all of the tiers of your medications, or it could be for tiers 3 through 5, just depending on your plan. But just realize that you have to pay that $615 before the insurance company will start to pay. The good news is, well, I guess it's good news, there is a Part D maximum out of pocket. It was $2,000 last year. It will be $2,100 this year. That $2,100 is the true out-of-pocket cost. So that's what you've paid, and that's also what the insurance company has paid. Once that reaches $2,100, then you don't have any more payment for that. Now, here's something that is going to be that's going to affect some people. If you have a brand name drug that is a tier 3, you may be accustomed to paying $42 for it as a flat fee, $47, or something like that. It's a flat fee that you've been paying. Well, a lot of the insurance companies this year are going to be going from a flat fee to a co-insurance. So let's say the co-insurance is 20%. So for instance, if you had a drug and that drug was, let's say, $600, $500, you were accustomed to paying $42 or $47 for that particular drug. If it's a 20% co-insurance, that $500 drug now is going to cost you $100 out of your pocket. So that's something to consider also. So it's definitely going to be important that you speak with an agent, preferably me, but you speaking with an agent so that you understand what your costs are going to be for 2026, because that could be a significant change for some people. So the other considerations that I want to talk to, and I'm going to go a little bit further in depth about each one of these, but I want to talk about prescription drug plans, the payment plans, changes in Medicaid eligibility, special needs plans, which I'm going to do a separate webinar on those all together. So I'm just going to talk about those a very little bit. SSBCI, we'll talk about what that is. The ending of value-based benefits, an employer creditable coverage letter if you get insurance from your employer, and then finally, prior authorizations that could possibly be coming to original Medicare. So that's kind of where we're going, but let's go ahead and get into it. So prescription drug payment plans. So each insurance company is going to be offering these payment plans. And these payment plans are the purpose of them is to make sure that you aren't paying as much for your prescriptions, or to kind of smooth out, if you will, what you're paying. So it'll be offered through your insurance company. You want to opt in and tell them that you're interested in it. So when you go to the pharmacy, you're actually not going to pay them anything. You're going to receive a separate bill from your insurer. and that payment is going to be divided by the number of months that's left in the year. I'm going to have an example of this on the next slide, and that a payment will adjust each year. So let's kind of break that down a little bit, because I know that that can seem a little confusing. So let's break that down. For instance, say you have your medications are $200. So for that first month, if you're in the drug payment plan, you're going to take that 200 and divide it by 12. So that means that you're going to get a bill from your insurance company for $16.67. Now, the second month is, let's say it's again $200. You're going to take that $200 and you're going to divide it by 11. And so that's going, because it's going to be 11 months left in the year. So based on that, that cost is going to be $18.18. So instead of getting another bill for $16.67, you may get a bill from your insurer for $34.85, which is the $16.67 plus the $18.18 for a total of $34.85. And then the third month, let's just round it out. The monthly cost for that month is $20, 200 divided by 10. And then that total cost might be a bill for $54.85. So it is smoothing, but each month that you are getting your medication, then it's adding to the total that you owe. So this may be something to consider for you, so that, you know, you may not be able to pay the $615 up front, but this will give you an opportunity to pay less of that, or pay it over time, if you will. Next, I want to talk about Medicaid eligibility, because Medicaid eligibility is going to change based on the different things that are happening. And there are some people that are going to find that they are not eligible for Medicaid any longer. Medicaid a lot of times is going to be picking up that Part A premium, that Part B premium, and that Part D premium. It is also going to cover copays. So if you find that you are no longer eligible for Medicaid, you are going to want to choose a new plan. And if you are in, there's 10 counties in Michigan. Wayne is included, and so is Macomb included in this. But if you have a plan that, well, let's talk about it on the next screen, because we're going to get into special needs plans. If you have a plan and your Medicaid eligibility is not full benefit QMB plus or SLMB plus, if you don't have any of those Medicaid designations and you have a dual eligible plan, you are no longer going to be eligible for that plan in 10 counties. So let me say that again a different way. You have to have these designations to have a special needs plan in these 10 counties in Michigan in 2026. That's an FBDE. QMB is not P, sorry, is QMB plus or SLMB plus. What that means is Medicaid covers all of your out-of-pocket costs for the most part. So Macomb and Wayne near me are those counties that you want to look at. Another thing that you may want to consider is if you lose that eligibility, there are certain plans that are called chronic special needs plans. And with those plans, if you have heart issues, if you're overweight, if you have diabetes, if you have kidney problems and other things, there are plans that are specifically designed for you. And so you may want to consider one of those type of plans, because that type of plan may lower your costs also, because the plan is based specifically for people with those type of issues. We're also going to be talking about special needs plans in another webinar. So don't worry about it if you don't really know or don't understand. We're going to go into more depth with that in another webinar. But I did want to bring that up to you in case you've lost your Medicaid eligibility. That might be a good option for you. So this is something to consider too that can give you more benefits. There are some plans that are going to have more benefits based on whether you have SSBCI. And what SSBCI stands for is Special Supplemental Benefits for the Chronically Ill. So there are certain Medicare Advantage plans that if you have a condition, it could be a chronic heart failure, chronic lung disease, kidney failure, diabetes, cancer, HIV, alcohol dependency. There's a lot of other SSBCI conditions that you can have. I think it's like 26 of them. If you have one of those and you have a Medicare Advantage plan, you may be able to utilize some benefits that can help you with food, gas, pest control, utility, rent assistance, and different things like that. So your insurance company may or may not automatically check to see if you're eligible for these things. So you may just want to call the insurer, call the number on the back, the customer service number on the back of your card, and see if you are eligible for these SSBCIs, because they can give you, again, more benefits. And that's something to consider that may be important for 2026. So moving on to the next thing that I want to consider is, so there's these thing called value-based benefits, and that's actually going to be ending in 2026. So you may see a decrease in some of those additional benefits that you've seen: dental, vision, and hearing, the over-the-counter, transportation, and more. So since this is ending, that's going to make some of these other things a lot more important: the special needs plans, the critical SSBCI, all of those things are going to be a bit more important. Realizing, so when you see a reduction in those things in your plan, it's happening all over. So it's not, it may not just be your plan, but it is something that's industry wide at this time. Now, this is for people that are receiving their Medicare coverage through their employer. So each year, your employer should send you a letter of creditable coverage. What that for your prescription drugs? That means that it's going to tell you whether or not your prescription drug plan is creditable. If it is not if it is creditable, you're all set. You don't need to think about it any further. Move on with your life. Yay, everything is great. If it's not creditable coverage, then you are going to have to look into a separate Part D prescription drug plan. Because if you don't have a prescription drug plan that has creditable coverage, you then become eligible for the late enrollment penalty. The late enrollment penalty is it accumulates, it continues on. So it's 1% for every month that you could have had creditable coverage, but you didn't. So that is, it continues to add up. And the thing about the Part D late enrollment penalty is that is a forever kind of penalty. So you want to make sure that if you are getting your coverage through your employer, that you know whether or not you have creditable coverage. You should have gotten that letter in the mail. You should be getting it soon. If you don't have it, then you need to reach out to them to find out for certain, because what you don't want to have happen is going into January 2026 and you think that you're all set. You think everything is great, and then find out that you don't have creditable coverage. And guess what? You can't get it again until the next annual enrollment period. So you would at least be a year without creditable coverage. And I don't want that to happen to you. So if you have an employer plan, make sure you contact your employer just to see if you have creditable coverage with your drug coverage. Again, if you do, you're all set. Nothing to worry about. But if you don't, then you're going to want to get a Part D prescription drug plan. Annual enrollment period is October 15th through December the 7th. October 15th through December the 7th. It ends on December the 7th. Okay. So you're going to have to get that Part D prescription drug plan before December the 7th. And again, that penalty, once you have it, it follows you for the rest of your Medicare career. You're going to have that penalty throughout. So don't want that to happen to you. And then finally, what I want to just kind of let you know is that if you have original Medicare, so you don't have you don't have a Medicare Advantage plan for this, but you may have original Medicare Part A and B. You may have original Medicare with a supplemental plan. Uh, if you have that, then I want you to know that they are doing a pilot program that is going to that's looking at doing prior authorizations. What's a prior authorization? A prior authorization is when the insurer, either the insurance company or Centers for Medicare and Medicaid Services, which is who Medicare comes through, the administrator of Medicare, when you have a service done, you have to get that service authorized before you can get it completed. So that is what's called a prior authorization. And so right now they're doing a pilot program in 6 states to see if this is something that they're going to be bringing to original Medicare. I know a lot of people stick with the supplements or original Medicare because there are no prior authorizations. But the thing about it is it could be coming. So that's just something to keep in mind. And then also, if you have a Medicare supplement plan, then your premium is going to increase next year. Well, it increases every year. I mean, you're accustomed to it increasing, but next year it may increase up to 15%. So a lot of times you don't know what your new Medicare supplement premium is going to be because they may change the price in either April or June or July. And so you're kind of stuck with that, whatever it is, until the next open enrollment. So if you've been considering whether or not to go from a supplement to a Medicare Advantage plan, our next webinar is going to talk about the difference between those two so you can kind of understand whether or not that's something that you really want to do. The next webinar is going to be next Tuesday at 10 a.m. And we're going to talk about the difference between a Medicare Advantage and a Medicare supplement plan so that you can understand the difference, because the premiums are going up again. And so whatever your premium is right now, just as a ballpark, multiply by 1.15 and see what it may be for next year, and see if you're comfortable with that amount. If you're comfortable with that amount, then you're all set. If you're not comfortable with that amount, then you may want to consider at least looking into what a Medicare Advantage plan can do for you. And again, you have to do that during the annual enrollment period, which is October the 15th through December the 7th. You can actually start talking about plans on October the 1st, but you can't actually do the any changing until October 15th. So that's something to consider also when you're thinking about this 2026. There's a lot of things going on for next year. There's going to be a lot of plan changes. So even if you're a person that has been comfortable with the plan that you've had, and you've had this plan for a number of years, and you're not the kind of person that wants to change, I can understand that, but you may want to consider this is the year to look into whether or not you want to make a change. And if you do, great. And if you don't, great. Because there are certain insurers and plans that are going away altogether, so you have to make a change. But if you are interested in having a conversation with me, I would ask you to do 2 things. There is a Medicare survey. So I'm not sure if you know what this is on the screen, but this is what's called a QR code. With a QR code, the only thing you need to do is take the phone, the camera on your cell phone, and put it up to the screen. When you put it up to the screen, you're going to see this little yellow URL that pops up. And so click your finger on that URL and it'll take you directly to the website. And so you can complete the Medicare survey. What the Medicare survey is going to ask you is your doctors, it's going to ask you your medications and everything like that, so that when we talk, I'll already have that medication and we can make it more efficient, and I can send you quotes and different things like that. And then the other ones, you can schedule an appointment with me. So the Medicare survey is going to give me your doctors, your prescriptions. It's also going to allow you to fill out that scope of appointment. What the scope of appointment will do is it gives me permission to be able to talk to you about the different plans. And so that's going to be very important too. So fill out the scope of appointment and then schedule an appointment so we can have a one-on-one conversation. Because what I don't want to do is have a generalized conversation with you, because sometimes, you get these calls and they want to sell you on the benefits. Oh, you can have this benefit and that benefit and this benefit and that benefit. And that's great. But if it doesn't cover your medications the way you need it to, or if your doctor doesn't take it and you don't want to change your doctor, then just because you have those benefits, it doesn't mean that you have what you need. And so it's important that you look at the entire picture. When you're looking at your Medicare, you're looking at the entire picture so that you understand what is going on with you and what is the best plan for you. And so we represent most of the major carriers here in the state of Michigan. And so I can help you with pretty much any company that's out there. I can pretty much help you to decide whether or not it's going to be a good fit for you. So I want to say thank you for spending this time with me. Thank you for giving me this opportunity. If you want to get in contact with me, this is how you can get in contact with me. If you are considering putting the block on your phone so that you don't get all of these Medicare calls, please put me in your phone so that you can get phone calls from me. The numbers are my office numbers is 313-472-5347. My text number is 313-450-9543. But you may get calls from that number too. So put both of those numbers in your contacts so that you can always contact me. If you have any questions or if you need anything, if there's anything I can do for you, please just don't hesitate to reach out to me. I look forward to working with you in 2026, and I pray you have a wonderful rest of your day. Thank you, and you take care. Bye.